Hi everyone. Today I come up with another topic which we deal about arrhythmia. In the previous section, I have dealt about the normal ECG and how to interpret ECG. Today move on to arrhythmia. I come up with the part 1. In part 1, I discussed about sinus arrhythmia and atrial arrhythmia. So first of all, see what is arrhythmia. As a definition, you see the arrhythmia is defined as the origin, rate, rhythm, conduct, velocity and sequence of heart activations are abnormally irregular. In a simple form, it is known as abnormal electrical activity of heart. Abnormal electrical activity of heart is called arrhythmia. Before moving to the topic, I just see about the conducting system of heart. This is the basic anatomy of heart, that is a physiological function. As you know, the anatomical pathway of conducting system, that is first of all SA node, otherwise sinoatrial node. Sinoatrial node, which is known as the pacemaker of heart. Pacemaker of heart is SA node. It can generate impulse. It automatically generate impulses of 60 to 100 per minute. So that is what our normal heart rate. So the impulses which is generated in the SA node, further it is moved on to the AV node, that is atrioventricular node. Further it is transmitted or conducted to bundle of his, then left and right bundle branches. This is a left and right bundle branches. Then left posterior fascicle, otherwise we call Purkinje fibers. Purkinje fibers which enters the myocardium, and there this is what the anatomical circuit, otherwise anatomical pathway of conducting system. What are the pathogenesis and inducement of arrhythmia, or which are the situations or the causes of this arrhythmia? First of all, some physical conditions. Some physical condition may be we are doing exercise or any strenuous activities. So such situations heart supposed to work more. That leads to arrhythmia. Then pathological heart diseases. Pathological diseases like myocardial infarction, heart failure, cardiomyopathy, so and so conditions that leads to arrhythmia. Then other system diseases may be because of any of other vital organs, diseases in the other vital organs that also proceed to arrhythmia. Then electrolyte disturbances and acid-base disturbances. Electrolyte disturbances like change in sodium, potassium and calcium levels in the blood that leads to abnormal electrical impulses. And acid-base imbalances, maybe acidosis and alkalosis. In the sense, acidosis may be, that is respiratory acidosis or metabolic acidosis. Alkalosis comes respiratory alkalosis and respiratory alkalosis. In these situations also there will be an abnormal electrical activity in the heart. And finally, the physical and chemical factors or the toxic forces in our body. Then classification of arrhythmia. This is the overall classification of arrhythmia. That is, mainly it is categorized into abnormal heart pulse formation and abnormal heart pulse conduction, and mix of abnormal heart pulse formation as well as conduction. These are the main classification of arrhythmia. So when there is a heart pulse formation, that is then there is a change in maybe ectopics other than the normal pathways. Certain times there is an abnormal origin of impulses that leads to arrhythmia. That is what that is further categorized into sinus arrhythmia, atrial arrhythmia, atrioventricular junction arrhythmia, or ventricular arrhythmia. Then, whereas the abnormal heart pulse conduction, that is, there is a failure to conduct from one area to other. So, such conditions come sinus atrial block, intra-atrial block, atrioventricular block, and intraventricular block. So, as a third classification, there is a mix of these both. So, in this section, I deal with sinus arrhythmia and atrial arrhythmia. You can continuously keep on follow my channel. The further sections I deal with each of the other types. So first see about sinus arrhythmia. Sinus arrhythmia, the worst condition is sinus tachycardia. Sinus tachycardia, from the word itself tachycardia, you know, increase the heart rate. So and the sinus, you know, that is a normal rhythm. So when it comes to sinus tachycardia, the characters are sinus rate that is more than 100 beats per minute. Usually the rate is between 100 to 180. So I repeat it, sinus tachycardia, the word sinus denotes normal rhythm, whereas the tachycardia denotes increased heart rate. So the causes for sinus tachycardia are some physical conditions, that is exercise, anxiety, exciting, alcohol intake, and coffee intake. And some diseases like fever, hyperthyroidism, anemia, and myocarditis, and drugs like atropine and isoprenaline. So when it comes to see about these causes, how exercise leads to increased tachycardia or increased heart rate. So when there is an exercise, anxiety or exciting, alcohol intake and coffee, so there is an increased metabolism, there is increased activity of the heart. So there will increase these causes which leads increase the metabolic demand in the body. When there is an increased metabolic demand in the body, heart will pump more blood. Otherwise, heart beats so fast to meet the metabolic demand of body. Similarly, when there is a fever, hyperthyroidism, in such cases also body demands more blood. That is increases the metabolic rate. Then when there is anemia, how anemia leads to tachycardia? When there is anemia, there is a decreased hemoglobin level. That is decreased hemoglobin, so decreased hemoglobin level in blood. When there is a decreased hemoglobin level in the blood, our peripheral, our body demands more oxygen because hemoglobin is the oxygen carrier. So when there is a decreased hemoglobin, our vital organs and peripheral body parts gets decreased oxygen supply. So automatically it demands more oxygen. So according to that, as a compensatory mechanism, heart beats more fast. And similarly, myocarditis also, it will increase the contractility of the heart. And other cause like drugs, that is atropine and isoprenaline, these are which increase the cardiac contractility. And here the management is, that is management says there is no need of any specific therapy. Only thing is treat the underlying cause. Treat the cause, that is the management of sinus tachycardia. So this is a ECG picture which shows that is SI node is depolarizing faster than normal and impulse is conducted normally. So to remember, sinus tachycardia is a response to physical or psychological stress. It's not a primary arrhythmia. So how is sinus tachycardia is deviated from normal sinus rhythm? That is, only thing is the heart rate is more than 100 beats per minute. And the second condition comes under sinus arrhythmia is sinus bradycardia. As it is said in the sinus tachycardia, sinus denotes normal rhythm, whereas bradycardia denotes decreased heart rate. So, the sinus rate will be less than 60 beats per minute. Usually we know normal heart rate is 60 to 100 beats per minute. So when there is a heart rate less than 60 beats per minute, that is called as bradycardia. So it is a normal variant in many normal or older adults. So the causes are trained athletics during sleep, those who are taking drug, especially beta blocker, and hypothyroidism, coronary artery disease, and sick sinus syndrome. Sick sinus syndrome. So these are the causes which leads to sinus bradycardia. The features, the symptoms, otherwise the clinical manifestations are most patients have no symptoms, that is asymptomatic, and severe bradycardia cause dizziness, fatigue, palpitation, and syncope. So as it is severe bradycardia, there is a because of bradycardia there decreases cardiac output. So that leads to decreased blood supply to vital organs, which leads to dizziness, fatigue, palpitation. Palpitation is a compensatory mechanism. Due to compensatory mechanism, patient have palpitation and develop syncope. So when comes to the management, here also there is no need of any specific therapy, but if the patient has severe symptoms, suppose go with the pacemaker implantation. Otherwise, the only management is treat the underlying cause. This is the ECG which shows sinus bradycardia. The etiology is SA node is depolarizing slower than normal impulse and is conducted normally. That is normal PR and QRS interval. This is what the ECG which shows sinus bradycardia, how it is deviated from normal sinus rhythm. Here the rate is less than 60 beats per minute. Even in the ECG graph you can understand that while calculating the heart rate from ECG paper, that is 300 divided by number of large squares, that is 1, 2, 3, 4, 5, 6, 7, 8, 9. 300 divided by 9, it goes that is 300 divided by 9, which is almost 35. That is we get 33.33. So we can round as a 35 beats per minute. Then third sinus arrhythmia is sick sinus syndrome. Sick sinus syndrome, otherwise triple S, which is the function of sinus node was degenerated. Sick sinus syndrome encompasses both disordered SA node automaticity and SA node conduction. So the causes are coronary artery disease, SA node degeneration, myopathy, connective tissue disease, metabolic disease, tumor, trauma, and congenital diseases. And with marked sinus bradycardia, sinus arrest, sinus exit block or junctional escape rhythms. And also it is known as bradycardia, tachycardia syndrome. So these are the main causes that leads to sick sinus syndrome. The ECG interpretation is through ECG we can find that the sinus bradycardia, that is most often the heart rate is less than or equal to 40 beats per minute and sinus arrest for more than 3 seconds, type 2 heart block, non-sinus tachyarrhythmia, that is supraventricular tachycardia, atrial fibrillation or atrial flutter. Then sinus node recovery time is more than 1530 milliseconds and instinct heart rate less than 80 beats per minute. These are the ECG findings when there is a patient has sick sinus syndrome. So this is the picturization of the graphical picture which shows supraventricular tachycardia as well as the sick sinus syndrome. And what is the management for sick sinus syndrome? As it is said earlier, is the sinus arrhythmia, so treat the underlying etiology. And the drugs which we use for sick sinus syndrome are anti-bradycardia agents and artificial cardiac pacing if needed. And next condition is sinus arrest or sinus standstill. So here the sinus arrest or standstill is recognized by a pause in sinus rhythm. So the main causes are myocardial ischemia, hypoxia, hyperkalemia, higher intracranial pressure, sinus node degeneration, and certain drugs which are digitalis and beta blockers. As you know, myocardial ischemia or the myocardial infarction, there is a damage to the myocardium. Hypoxia in the sense decreased oxygen level in the cell or tissue. Hyperkalemia in the sense increased serum potassium level. And high intracranial pressure, that is increased intra-ICP. Then sinus node degeneration and drugs like digitalis and beta blockers. There is a beta blocker that is a antihypertensive where also it will reduce the heart rate. Then the major symptom is dizziness and syncope, that is because of decreased cardiac output. The treatment for sick sinus syndrome, which is similarly the treatment for sinus arrest or the sinus standstill is similarly what is for the sick sinus syndrome, that is treat the cause and use pharmacological therapy and if needed go with the pacemaker implantation. Next section, the next category is the atrial arrhythmia. When there is a atrial arrhythmia, the first one is premature contraction. When you see regarding premature contraction, the term premature contractions are used to describe non-sinus beat in the sense that are no normal rhythm. These are common arrhythmia and the morbidity rate is about 3 to 5%. Next condition is atrial premature contraction. Atrial premature contraction arising from somewhere in either the left or the right atrium. In the sense, usually the impulse is generated from sinoatrial node, otherwise SA node. That is what the actual or the original pacemaker of heart. So, other than the SA node, maybe from other foci, the impulse generated. That is what the somewhere other from the left or right atrium impulse generated. That is what atrial premature contraction. The causes like rheumatic heart disease, coronary artery disease, hypertension, hyperthyroidism and hypokalemia. The major symptoms like many patients have no symptom, that is asymptomatic. Certain the features like they express palpitation and chest discomfort. The treatment for atrial premature contraction is there is need in therapy. This is no need of any therapy if there is a asymptomatic. So it can be treated with beta blocker, propafenone, morphine, or verapamil. This ECG graph which shows the premature atrial contractions how it is deviated from normal sinus rhythm. That is this picture which shows the premature, the otherwise the ectopics. Okay, these ectopic beats originate in the atria, but not in the SA node. This is from other than the SA node, it developed from the atria. Therefore, the contour of P wave, the PR interval, and the timing are different than normally generated pulse from a SA node. Here also the etiology is excitation of an atrial cell, that is excitation of an atrial cell forms an impulse that is then conducted normally through the AV node and ventricles. That is what premature, otherwise not normal impulses of the rhythm we can identify in the ECG. Next is the atrial tachycardia. Atrial tachycardia, which is classified into three categories. Atrial tachycardia already knows that is the atrial rate increases, that is increased heart rate, that is the atrial rate. So this is classified into automatic atrial tachycardia, that is we will see one by one the later. That is first one is automatic atrial tachycardia, second one is intra-atrial reentral atrial tachycardia, and chaotic atrial tachycardia. The main etiological factors, other the causes are atrial enlargement, myocardial infarction, chronic obstructive pulmonary disease, drinking alcohol, metabolic disturbances, digitalis toxicity, and electrolyte disturbances. Then it may occur transient, intermittent, or persistent. The major symptoms are palpitation, chest discomfort. Tachycardia may induce myopathy because as a long-term tachycardia exists means it will destroy the capability of myocardium. That is, there is a myocardial degeneration happens. And on auscultation, the first heart sound is variable. Next is the intra-atrial reentral tachycardia. The ECG characters of intra-atrial reentry tachycardia is that is atrial rate is around 130 to 150 beats per minute. P wave is different from sinus P wave. That is sinus P wave means the duration of sinus P wave is 0.08 to 0.12 second. Also it is a normal one. But when here the P wave is different. Similarly, PR interval will be more than or equal to 0.12 seconds. Often appear type 1 or type 2 2:1 AV block. Electrophysiological study shows atrial program pacing can induce and terminate the tachycardia. Next is the automatic atrial tachycardia. The ECG characters of automatic atrial tachycardia is atrial rate is around 100 to 200 beats per minute. Is something like a warm-up phenomenon. That is something that develops in the initial stage. Here also the P wave is different from sinus P wave. PR interval that will be more than or equal to 0.12 seconds. Often appear as it is said earlier type 1 or type 2 2:1 AV block. Here also the electrophysiological study shows atrial program pacing can't induce or terminate the tachycardia. Is the third type chaotic atrial tachycardia. This is also termed as multifocal atrial tachycardia. The main cause of multifocal atrial tachycardia is most often occur in COPD or congestive heart failure patients. It has a high in-hospital mortality, that is around 25 to 56%. The death is caused by the severity of the underlying disease. The ECG characters of multifocal tachycardia is the atrial rate is around 100 to 130 beats per minute. The morphologies P wave are more than 3 types, that is PP, PR and RR interval are different. It will progress to atrial flutter in half of the cases. That is, if it is not reverted easily, then it will be progress to atrial flutter. Then electrophysiological study, the atrial program pacing can't induce or terminate the tachycardia. Then treatment for each of the category. For intra-arterial reentral atrial tachycardia, the management is esophageal pulsation modulation, radiofrequency catheter ablation, that is antiarrhythmic drugs, antiarrhythmic drug classification 1C and 4. Then automatic atrial tachycardia, the treatment options are digoxin, class 4, 2, 1A and 3 class of anti-tachycardia agents, in the sense antiarrhythmic agents, and radiofrequency catheter ablation. Radiofrequency catheter ablation. Then chaotic atrial tachycardia. The chaotic atrial tachycardia, which treat the underlying disease, and also the drug of choices are verapamil or amiodarone. That is an antiarrhythmic category. If it is associated with the sick sinus syndrome, need to implant pacemaker, that is go with the pacemaker therapy. The next category, that is next atrial arrhythmia, is atrial flutter. The etiology of atrial flutter, it usually occurs patients with normal atrial or with the abnormal atrium. It is seen in rheumatic heart disease, that is mitral or tricuspid valve disease, coronary artery disease, hypertension, hyperthyroidism, congenital heart disease and chronic obstructive pulmonary disease. This atrial flutter, which is related to enlargement of atria, most atrial flutter have a reentry loop in right atria. So here is the ECG rhythm, how it is deviated from normal sinus rhythm. In atrial flutter, no P waves. Instead, there is a flutter waves. Flutter waves are categorized as, that is categorized otherwise denoted as sawtooth pattern, which are formed at a rate of 250 to 350 beats per minute. So when you see the ECG rhythm, otherwise ECG, it shows there is no regular P wave. Instead, that waves are called flutter waves. That is, this is something looks like a sawtooth, like this. That is what it is called. The pattern is called sawtooth. The rate is 250 to 350 beats per minute. Only some impulses conduct through the AV node. The clinical features, otherwise the symptoms of atrial flutter, which depends on underlying disease, and ventricular rate, the patient is at rest or exerting. With a rapid ventricular rate, the patient shows the features of palpitation, dizziness, shortness of breath, weakness, faintness, syncope, and also may develop angina and congestive heart failure. So when there is an increasing rate, definitely the patient shows the palpitation. Then when there is an increasing palpitation, there is a decreased filling. Otherwise, the atrial filling decreases, so automatically there is a decreased cardiac output. So there is a decreased perfusion to vital organs. So they develop dizziness as a compensatory mechanism. Patient develops shortness of breath, then have fainting and weakness and syncope. Also, it may develop to angina and congestive heart failure. The treatment for atrial flutter, first and foremost, is treat the underlying disease. Then second option is restore sinus rhythm. So the treatment option is cardioversion. Cardioversion, as you know, this is a synchronized electrical shock. Okay, this is an elective procedure. Low joule of electrical current is passed to uh, restore the sinus rhythm in the heart. Next is the esophageal pulsation modulation, radiofrequency catheter ablation. Then drugs which we administer are class 3, 1A and 1C in the anti-arrhythmic drugs. Then control the ventricular rate. To control ventricular rate, administer digitalis, calcium channel blocker and beta blocker. Then finally, anticoagulation therapy. Anticoagulation therapy with maybe warfarin or low molecular heparin therapies. The next condition is atrial fibrillation. Atrial fibrillation, which is subdivided into three types, that is paroxysmal atrial fibrillation, persistent or permanent atrial fibrillation. The causative factors of atrial fibrillation are morbidity rate increase in older patients, etiology just like atrial flutter, and it is idiopathic. The mechanism is multiple wavelet reentry of atrial impulses. So when there is a wavelet reentry, there is a rapid firing focus in pulmonary vein, vena cava or coronary sinus. So the manifestations in atrial fibrillation are affected by the underlying disease, ventricular rate and heart function. Because of what may be the underlying pathology, based on that pathology there will be a change in the ventricular rate and cardiac function. Also develop embolism in left atrium that leads to high incidence of stroke. Then heart rate, the heart rate and first heart sound and rhythm is irregular. If the heart rhythm is regular, should consider about restore sinus rhythm, atrial fibrillation with a constant, the ratio of AV conduction, junctional or ventricular tachycardia, slower ventricular rate may have complete AV block. Treatment for atrial fibrillation. As it is said in the atrial flutter, the first and foremost treatment is treat the underlying disease. Then the second goal is restore sinus rhythm. To restore the sinus rhythm, administer drugs. That is most often the drug of choice is amiodarone or codrone. Amiodarone or codrone. Then cardioversion, radiofrequency catheter ablation and mace surgery. Then control the rate. To control rate, administer digitalis, calcium channel blocker and beta blockers, and antithrombotic therapy with aspirin or warfarin. With this, it completes about sinus arrhythmia and atrial arrhythmia. Keep watching, keep following and subscribe the channel. In the further sections, discuss about junctional arrhythmia and ventricular arrhythmia, followed by heart block and further management of arrhythmia and heart block. Thank you.